Zerbaxa is an antibiotic drug used to treat bacterial infections. It binds to the bacterial cell membrane and interfere with protein involved in cell wall synthesis, ultimately inhibiting formation of cell wall. Zerbaxa is used for the treatment of bacterial infections, intra-abdominal infections, urinary tract infections, and pneumonia. Zerbaxa treat complicated intra-abdominal infections caused by gram-negative and gram-positive microorganisms, such as Enterobacter coli, Escherichia coli, Klebsiella oxyutica, Klebsiella pneumonia, Proteus microbilus, Pseudomonas aeruginosa, Bacteroides fragilis, Streptococcus aeruginosus, Streptococcus constellitis, and Streptococcus salmonellus. Zerbaxa drug treat complicated urinary tract infections, such as pyelonephritis caused by gram-negative microorganisms, such as Escherichia coli, Klebsiella pneumonia, Proteus microbilus, and Pseudomonas aeruginosa. Zerbaxa drug treat nosocomial pneumonia caused by gram-negative bacteria, such as Enterobacter coli, Escherichia coli, Haemophilus influenzae, Klebsiella oxyutica, Klebsiella pneumonia, Proteus microbilus, Pseudomonas aeruginosa, and Zerbaxa marasacin. Zerbaxa is an antibacterial agent active against Pseudomonas aeruginosa and other gram-negative bacteria, including extended spectrum beta-lactamase, producing Enterobacteriaceae. Zerbaxa contain ceftolozane, which exert bactericidal effect by inhibiting penicillin binding protein, resulting in inhibition of cell wall synthesis and subsequent bacterial cell death. Additionally, Zerbaxa contain tazobactam, a potent beta-lactamase inhibitor that bind to both chromosomal and plasmid-mediated bacterial beta-lactamase. Tazobactam is a beta-lactamase inhibitor with significant activity against beta-lactamase produced by bactericidal fragiles. Intra-abdominal infections refer to inflammation or infections that following a breach in the intestinal mucosal defense barrier, permitting normal bowel flora to enter the abdominal cavity. Infection result from disruption of the gastrointestinal tract, including conditions such as appendicitis or diverticulitis. and complicated intra-abdominal infections are confined within the wall of a single organ. In contrast, complicated intra-abdominal infections extend beyond the initial organ and may result in serious conditions such as abscess formation, characterized by a localized collection of pus surrounded by a fibrous capsules, and a peritonitis, defined as inflammation of the peritoneum. A urinary tract infection is an infection of the urinary system, which include the kidneys, urethra, bladder, and urethra. Lower urinary tract infections involve the bladder or urethra, while upper urinary tract infections involve kidneys. Urethritis is inflammation of the urethra, typically caused by bacterial infections, often resulting from sexual transmitted infections. Gonococcal urethritis is caused by diphtheria, gonorrhea, while non-gonococcal urethritis is caused by chlamydia trachomatis. Other causes are Mycoplasma gentium, Trichomonas vaginis, uropathogenic Escherichia coli, and herpes simplex virus. Urinary tract infections caused by Escherichia coli can be treated with Zerbaxa. E. coli is a gram-negative, facultative, anaerobic, rod-shaped, coliform bacterium that normally resides in the gastrointestinal tract of a human and animals. While most strains are harmless, some can cause disease in a human. E. coli infections may present as gastrointestinal or urinary tract infections, as well as bloodstream infections, bursitis, and pelvic inflammatory disease. Some types of E. coli are Shiga toxin producing E. coli, STES, enterotoxinic E. coli, ETES, enteropathogenic E. coli, EPES, enteroaggregative E. coli, EAES, and others. Zerbaxa is used to treat nosocomial pneumonia, which can be caused by Staphylococcus species, intestinal bacteria, and other microorganisms, such as Pseudomonas aeruginosa. Nosocomial pneumonia, also known as hospital-acquired pneumonia, is defined as pneumonia that develops 48 hours or more after hospital admission. This condition is characterized by inflammation of the lung tissue due to infections and is a common cause of morbidity in both adults and children worldwide, often leading to serious complications. Enterobacteria SA, Pseudomonas aeruginosa, and Staphylococcus aureus are most common pathogens involved in hospital-acquired pneumonia. Some studies show that infection caused by multi-drug resistance (MDR) pathogen, which increase the risk of death. Enterobacteria SA is a large group of gram-negative bacteria. Enterobacteria SA infection can cause various infections, such as bacteremia, lower respiratory tract infections, skin and soft tissue infections, and urinary tract infections. Pseudomonas aeruginosa is encapsulated gram-negative rod-shaped bacterium. Pseudomonas aeruginosa can cause various infections, such as pneumonia, septic shock, urinary tract infections, gastrointestinal tract infections, and others. Staphylococcus aureus is a gram-positive bacteria. Staphylococcus aureus can cause infection in respiratory tract and on the skin. Thank you for watching the video. Please check other videos in the channel and please like and subscribe to this channel.